Hi, Gordon Anderson again, gordontheguru.co.uk. The title of this video is Reduction to the Ridiculous. You may wonder what that's all about. Well, I'm really talking about something that I know as reductionism or allopathic medicine. In about 1910 it became mainstream, and from a very young age these days we're conditioned to go and see the doctor. Technically, they're known as reductionist allopaths. Their training is to reduce the symptoms of a disease, really manage the condition. And when someone goes to a doctor, you'll be possibly prescribed drugs that give us a clue. It's an anticoagulant, it's an anti-inflammatory, it's an antihistamine, an antidepressant. It could be a beta blocker, a calcium blocker. So the names of these drugs gives us a clue, and it's to suppress the symptoms. When you come to someone like myself, a holistic practitioner, first of all I'll invest a lot more time with someone, and I'm interested in the bigger picture. But rather than address the symptoms and see if we can reduce them, allos means to fight or to oppose. Pathology means the disease, so an allopath means to fight the disease, and that's the training that these doctors use these days. Not that I'm knocking doctors, but that's their training. Most of us from a very young age are conditioned to go to the doctor. You get sick, you go to the doctor. And I sometimes remind people that, you know, when they go to a health centre and they see the sign above the door there, that a more accurate name for that place is the sick centre. It's actually the exact opposite of what we call it, and oftentimes we're going there to react to a particular condition or symptom or whatever it may be. So I'm in the business of promoting good health, coming from boosting our immune system and our full functional ability, our hormone function, our immune system function, to fully support our body. So we're looking at our biochemistry, we're looking at our physiology, how we move, how we don't move, what we put in our body, don't put in our body. We're also looking at our emotional health. You know, the level of stress that we're under, whether it's, you know, relationship stress, job stress, whatever's going on there. So we're looking at the holistic picture and the root cause of what might be causing the particular condition. And we'll look at it holistically, and we're looking for the cause. And the very best analogy that I could give you is if we were on a ship right now and there was water coming on board. Well, the allopathic reductionist approach, called medical treatment or, you know, prescription drugs, is to continually bail out the water. That's treating the symptom. My approach is to look for the cause. Makes sense, doesn't it? Where is this water coming in? Let's find the cause, the root cause, restore it, get the integrity of the vessel, to use the analogy, your body, back in optimum condition, and then we'll bail out whatever's left. So I'm here to tell you that reductionism, known as medical treatment, going to the doctor, is an alternative. You have other alternatives. You may have heard of some of them: homeopathy, herbalism, Ayurvedic medicine, Chinese medicine, chiropractic. There are lots of modalities that you can go and be treated, and these approaches tend to work in harmony with your body, support your immune system in a non-invasive way. Most of the times we're not offering any kind of treatment that deals with the symptoms, we're not after the underlying cause. So you do have alternatives, and when I say reduction to the ridiculous, I'm just saying that the ridiculous is that people believe the only game in town is to go to the doctor. Again, I often talk about it, success leaves clues. One of the healthiest nations in the world are the traditional Chinese. And they will use medical treatment in case of an emergency. So where someone's been injured and they need restorative treatment, if it's a broken bone or if it's a cut that needs stitches, if they need pain medication, that's where they use medical treatment. Aside from that, they use acupuncture, acupressure, they use herbs, they use a whole range of different non-invasive natural approaches to support you. So you do have options, just know what they are. I'm very big at promoting informed choices, so just know that you have some in addition to conventional medicine. Not that I'm here to knock doctors, but that's their training. And so with that, you know, be well, and I'll talk to you soon. Bye for now.